Okay, so I'm going to be performing a wound dressing change. Prior to coming into my patient's room, I'm going to look at the chart. I see that my patient is on a droplet precaution, so when gathering all of my supplies and my equipment that I'm going to need, I am also going to make sure that I gather a mask and a gown. So I'm going to go ahead and put on my gown. Alright, now I'm going to perform some hand hygiene. I'm going to put on a clean pair of gloves. And I'm going to head on to my patient's room. Come in. Hi, Avon. My name is Jordan. I'm going to be your nurse today. I'm the nurse here from 7P to 7A. So you'll have me for the next 12 hours. I'm going to be changing the wound dressing on your calf. And it should only take me maybe about 10-15 minutes. Okay, so I'm going to place this drape underneath my patient's calf. I also want to note that prior to coming into my patient's room for the wound dressing change, that I am going to assess their pain level 20 minutes prior on the 0 to 10 pain scale. If my patient's having any pain, I am going to want to administer pain medications 20 minutes prior to this procedure. Also, when coming in, I do want to provide for privacy, so I'm going to go ahead and typically I would just shut the door behind me, but if it's a 2-bed patient room, I'm going to close the curtain for privacy. And I'm also going to ask my patient, are you comfortable in this position for me to change your wound dressing?
Yeah.
Okay, so perfect. So I am going to start by removing the old dressing. So I'm going to toss that. After taking off that wound dressing, I'm going to assess the drainage to tell if it's serous sanguinous, or purulent. I'm also going to assess the appearance of the wound as a whole for any redness, swelling, granulation, approximation of the wound. And then I'm going to want to measure the length, width, and depth of the wound. And then to measure the depth, I'm just going to take one of my cotton-tipped applicators and measure the depth of the wound. And then I can mark my spot on the depth and hold that up to my tape measure. That'll tell me how many centimeters in depth the wound is. So after doing that, I'm going to remove these gloves. I'm going to perform that hand hygiene once more. I'm going to put on a clean pair of gloves. So, doing this video on my phone makes it a little bit difficult to see what's going on. I'm going to move my patient's leg here a little bit. So I'm going to place the items I'm going to need for the wound dressing change. So opening up my cotton swab applicators. Going to open up these gauze pads. Going to open up my abdominal pad. I've got my tape here that I'm going to need. And I've got my cleaning solution. So now I've got my patient's calf wound, and I'm just going to take one of my cotton swabs. I'm going to dip that in my cleaning solution. I want to make sure that when I'm cleaning the wound, I am going from the inside out. So I'm just going to be cleaning around the wound. So now that I have cleaned the wound, I would take my Lotiform if I had it. I didn't get it in my kit, so but I would take that and I would cut it out to the size that would fit my patient's calf wound, and then I would pack that with one of these cotton tip applicators to help assist with that. So I would be packing her wound, making sure that fit properly into the wound. I'm going to take my gauze pad, place it over the wound, and then I will take my abdominal pad to cover that with. And now I will tape up her wound. I have some scissors here to help with taping that. Okay, so now that I have my patient's wound covered, I want to make sure that I'm putting the date on the wound, the time that I did the wound dressing change, and then my own initials. So once that is finished, I am going to remove this pad out from underneath my patient. I am going to get rid of the rest of the supplies that I have in the room, throw those away in the trash. I'm going to ask Avin, are you comfortable in this position?
Yeah.
Okay, so my patient is comfortable. I'm going to make sure that my patient has at least just 2 of the side rails up. I'm going to make sure that it's in the lowest setting. The bed is locked. Make sure they've got their call light within reach, their water within reach, any personal items that they might need. Phone is a big one. I'm going to make sure they have all of that. And then I'm going to remove my gloves. I'm going to, again, perform hand hygiene. I'm going to remove my gown. And then I'm going to remove my mask. And that is my wound dressing change check off.